Hello everybody. So today I'm just going to give you a bit of an update on the pregnancy. I'm now 6 weeks and 4 days. I wanted to update at about 6 weeks, but I wanted to actually give an actual update. I didn't want to post something that I was only able to post part of, but right now that's kind of where I'm at. So on Monday I was 6 weeks, but the kids started school this week, so we ended up having to go get all of their school supplies and things for them to start. And their first day was on Wednesday. So I dropped them off at the school, and that morning I had noticed that I was actually spotting and having cramping. So I kind of waited it out until about lunchtime when I gave the clinic that I go to a call and asked them basically what I should do, figuring that they would just tell me, to rest, because it's fairly common and normal in pregnancy to just spot. And so because it was going from the old blood style dark color to a lighter, more recent, like a reddish color, which means that it's fresh blood, they told me to come in and be checked out just in case. So I got there I had just the 3 little ones with me because the bigger ones were in school. So I just popped up there and talked to them a bit, and they decided to do an ultrasound since their tech was actually there at the time. They did the ultrasound. She basically didn't talk at all. I didn't see anything, I didn't get to see the screen. It was always turned away from me. So it was basically just, how far along are you? And then you can go wait in the waiting room. But when I got to the waiting room, the not the doctors, but the medical office assistants at the desk told me that I could go home. And so basically I did. And then just wait for a response or some information. But that was on Wednesday, and today is Friday and I didn't receive a call, so I didn't really want to do an update where I couldn't really say anything. So I gave them a call this morning, and they gave me a call back this afternoon to say basically that the ultrasound was okay. There was a little bit of a hemorrhage, which is probably where the bleeding's from, as well as the sac looks slightly irregular and is apparently large. So when they measured it, they said that it's measuring, they didn't really measure the baby, I don't think. It was the sac that they mostly measured, and it would be measuring at 7 weeks and 5 days on Wednesday. So I was only 6 weeks and 2 days on Wednesday, so the sac is measuring 10 days ahead. And other than that, they just said that they could see a baby with a heartbeat and it seemed okay, but I have to come in next week for a follow-up ultrasound. I don't have an appointment for that, so I won't be able to update that until probably the 8-week maybe update. But for now, basically, I don't have a whole lot to update beyond the fact that I did get an ultrasound and it's saying that the sac is measuring 10 days ahead. So that's kind of interesting. I'm not really sure what that means. If you Google, it can be, the devil sometimes, where it will tell you that you have every sickness in the world and that you're dying when you Google a cough. So there's lots of things that come up when you Google, such as twins, which we already thought that it might have been anyways. But so we'll see, I guess, what the ultrasound next week has to say about all this. Other than that, I have been sick pretty much continuously since I found out. It's really kind of hard to eat because I feel nauseous pretty much all the way up until dinner time every single day, and even sometimes further than that. So when I weighed myself, I found that I've probably lost between 6 to 8 pounds in the last 2.5, almost 3 weeks, which when you're pregnant, you're supposed to, at this point, either maintain or possibly even gain, not lose. So one thing that they actually did when I called in today is to send in a prescription for diclectin, which is a pill that's supposed to help with nausea. It's a combination of B6 and an antihistamine. I do have some left over from Eliphalet that I have been taking on occasion, but since it has an antihistamine, it makes you really tired. So that's not something that you really want when you're first trimester and already really, really tired. So, and the ones I had obviously were prescribed last July, I believe. So they didn't really say that there would be a problem in me taking them, but obviously if we have insurance, then it would be better to have a fresh set of pills rather than ones that we don't know how good they or don't know how long they're good for. So I'm going to go pick those up today, and then I'll have to update, I guess, around 8 weeks or maybe sooner, depending on what shows up at the ultrasound. I have no idea. Apparently it can either mean that there's twins, or maybe that it's just not viable, or that you have a vanishing twin. I have no idea at this point, and I couldn't even take a guess right now. So yeah, we'll just have to see what happens in the future. I don't really have a belly shot because it would be even less of a belly than last week, so I'm not sure that, or 2 weeks ago, so I'm not sure that there would be much of a point in that. Alright, so that's all I have for today, and then I'll update you again in another 2-ish weeks on how things are going. See ya!